Hello friends, so let's discuss one of the important disease that is nothing but our herpes zoster. Okay, so it is a acute viral infection, as you can see here, that is caused by our varicella zoster virus. The varicella zoster virus causes the chicken pox also, but once the chicken pox get treated, उसके जो हमारे जो नर्व सेल्स होते हैं ना, उसके एंडिंग में नर्व एंडिंग में काइंड ऑफ उसका डॉर्मेंट स्टेट, यानी कि वंस द चिकन पॉक्स हैज़ बिन डन, तो चिकन पॉक्स के अगेंस्ट हमारे बॉडी में अ काइंड ऑफ इम्यूनिटी डेवलप हो जाती है. तो चिकन पॉक्स अगेन नहीं होगा. लेकिन इफ़ देर इज़ अ इम्यूनोसप्रेसेंट ड्रग यू आर टेकिंग, HIV है पेशेंट को, वी हैव अ काइंड ऑफ इम्यूनोसप्रेसेंट ड्रग, स्टेरॉइड कंज्यूमिंग बहुत कर रहा है, तो डेफिनेटली देर इज़ अ इम्यून सिस्टम वीकन हो जाएगा. एंड दैट्स वाई देर इज़ अ री अटैक ऑफ आवर दिस varicella zoster virus in the form of shingles, not the chicken pox, because already chicken pox के against body में immunity develop हो जाएगी once it occurs. Okay, so it is also known as herpes zoster, is also known as shingles, is an acute viral infection of the nerve cells and surrounding skins that is characterized by presence of rashes with blisters and can be very painful, but it is not a life threatening. Okay, we can treat it by giving antiviral. Okay, antiviral therapy. So it is caused by the varicella zoster virus, also causes the chicken pox, and once the chicken pox get treated, that is happens or get reattacked in the form of shingles. Okay, not a chicken pox. Okay, how it reattacked, because its dormant state, और you can say उसका जो latent stage है वो हमारे बॉडी में रहता है, बट एज सुन एज देर इज इम्यूनिटी सप्रेस ड्रग वी आर टेकिंग, इम्यूनिटी डाउन होती है ना, तो दिस इज अ री अटैक ऑफ दैट पर्टिकुलर वेरिसेला जोस्टर वायरस इन द फॉर्म ऑफ शिंगल्स कॉल्ड एज अ हर्पीस जोस्टर. ओके, तो यू कैन सी हियर शिंगल्स यूजुअली अपीयर्स बैंड्स ऑफ ब्लिस्टर्स ऑन वन ऑफ द साइड ऑफ द चेस्ट. ओके, दैट इज यू कैन से इसका फीचर्स यही है, शिंगल्स यूजुअली अपीयर्स bands of blisters on one of the side of the chest or backs, but it can occur anywhere on the body, including on the face and the near the eyes. Okay, so it can happen anywhere of the body, but it is usually occurring on the one side of the body. Okay, that is unilaterally it is visible, not bilaterally. If you divided this body into two equal halves, definitely that is appearing on the one of the halves. Okay, not cover the both halves. Okay, that you should know. So shingles usually appears band of the blisters on one of the side of the chest or backs, but it can occur anywhere on the body, including on the face and near the eyes. So anywhere on the body that can appear, but definitely there is only one half of the body having a this kind of symptoms. Okay, so varicella zoster virus infection causes two clinically distinct form of disease, one of the chicken pox and one is the shingles. Okay, so chicken pox and shingles. So the chicken pox होता है, that is called the varicella disease, and the chicken pox the shingles is nothing but our herpes zoster. Okay, so I already discussed to you, it's a herpes DNA. A primary infection result in the varicella, chicken pox, just I said, and recurrent infection result in the herpes zoster. Okay, shingles जिसे हम बोलते हैं. So you can see here how it transmitted, direct contact with open sore of the shingles rashes. ऑलरेडी किसको अगर हर्पीस जोस्टर का इन्फेक्शन हुआ है तो डायरेक्ट कांटेक्ट, अगर उसका जो ब्लिस्टर से जो पल्स वगैरह जो आएगा, डायरेक्ट कांटेक्ट विद दैट इट कैन ट्रांसमिटेड. ओके, कैन पास टू समवन हु हैज़ नेवर हैड द चिकन पॉक्स. ओके, दैट इज ऑल्सो कैन हैपन. एंड हाई इंसिडेंट ग्रुप्स हु हैड अ काइंड ऑफ चिकन पॉक्स इन देयर लाइफ. ओके, पास्ट हिस्ट्री में अगर चिकन पॉक्स है, देर इज अ हाई चांसेस ऑफ अकरिंग दिस काइंड ऑफ हर्पीस जोस्टर और शिंगल्स. तो पीपल ओवर द एज ऑफ 50, अगेन देर इज अ मोर चांसेस ऑफ दैट. तो इनक्यूबेशन पीरियड इज 10 to 21 day of this herpes zoster infection. Patient may present to you kind of by unilateral sided of the body में वो kind of skin rashes वगैरह लेके आएगा. So there is a developmental period. As soon as it passes, there is a rashes will more and more on one side of the body. Okay, so you can see here the pathophysiology, you should know, this is the important chart, you can take a screenshot of this also. Okay, the varicella zoster virus enter through the respiratory tract as the infected person breathes. Okay, so varicella zoster virus enters through the respiratory tracts. Viral replication in the regional lymph nodes occurs. So as soon as enter into the respiratory tracts, we have a kind of number of lymph nodes, cervical lymph nodes. We have a recurrent, you can say laryngeal lymph nodes are there. So we have a number of lymph nodes. It multiply in the lymph nodes. Okay, and ultimately it enter into the bloodstream. ओके, वो ब्लड में भी जाता है, दैट इज कॉल्ड एज अ प्राइमरी वायरेमिया. ओके, प्राइमरी ईमिया मीन्स ब्लड में, तो प्राइमरी वायरेमिया इन द ब्लड स्ट्रीम. तो फर्दर वायरल रेप्लिकेशन इन लीवर एंड स्प्लीन इट अकर्स, एंड दैट इज द सेकेंडरी वायरेमिया. ओके, तो एक बार ब्लड में गया, ब्लड में जाने के बाद वो लीवर और स्प्लीन में पहुंचता है, लीवर और स्प्लीन में मल्टीप्लिकेशन होता है एंड देयर इज अ सेकेंडरी वायरेमिया। ओके, मल्टीप्लिकेशन बहुत सारा हो जाने के बाद वो क्या होता है, अभी ब्लड में पहुंच जाता है। ओके, तो आप देख सकते हो इट एन इनटू द बाय सेकेंडरी वायरेमिया पूरे ब्लड सर्कुलेशन में फैल गया। अभी क्या होगा, इट एन एंटर इनटू द नर्व एंडिंग एंड ट्रांसपोर्ट टू द डोर्सल रूट गैंग्लियन। ओके, एंड वेयर इट लाइज अ डॉर्मेंट इन द सेंसरी नर्व गैंग्लिया डोर्सल रूट। ओके, दैट इज नथिंग बट जो हमारे नर्व एंडिंग में वो डॉर्मेंट स्टेज में रहता है। तो एज सुन एज देर इज a kind of low immunity in the body, there is a reactivation in the dorsal root ganglion and infection of the nerves and dermatome, or you can say infection of the nerves is happens, and that is called as a herpes zoster. Okay, तो it is a you can say neuronal disease you can say. Okay, तो इसमें nerve damage हो रहा है सीधा. So primary viremia, secondary viremia followed by reactivation. How it happened reactivation? Because there is a latent phase, or you can say dormant stage of that particular herpes zoster is there in the nerve ending. Okay, once it occurs, or you can say once the chicken pox has occurred, there is a dormant stage यहाँ पे रहेगा, and suppose shingles का direct contact हुआ तो definitely this kind of pathophysiology will be occur in that particular person. Okay, तो अगर direct contact हुआ है shingles वायरस का तो definitely respiratory tract, अगर किसको shingles वायरस हुआ है या फिर you can say herpes zoster हुआ है और उसके respiratory tract के थ्रू हमें हमारे बॉडी में आता है तो डेफिनेटली रेस्पिरेटरी ट्रैक्ट के थ्रू आ रहा है तो वी विल इनहेल दैट एयर. ओके, एंड इट विल एंटर इनटू द लंग्स में जाने के बाद लिम्फ नोड में जाएगा वो जो पर्टिकुलर ऑर्गेनिज्म है जो वायरस है. ओके, और वहाँ पे जाने के बाद काइंड ऑफ लिम्फ नोड में इन्लार्जमेंट होगा, लिम्फ नोड का इन्लार्जमेंट होगा, लिम्फ नोड से वो ब्लड स्ट्रीम में जाएगा एंड एज सुन एज इट एंटर इनटू द ब्लड स्ट्रीम दैट इज कॉल्ड एज प्राइमरी वायरेमिया. ओके, एंड एज सुन एज इज प्राइमरी वायरेमिया वाया इट्स प्राइमरी वायरेमिया इट एंटर इनटू द लिवर एंड स्प्लीन एंड अल्टीमेटली दैट इज कॉल्ड एज अ secondary viremia. तो after liver and spleen it enter into the blood again, that is called as secondary viremia. Okay, तो secondary viremia के बाद वो नर्व एंडिंग और नर्व वगैरह को डैमेज करता है, नर्व एंडिंग को डैमेज करता है, डॉर्सल रूट गैंग्लियन में डॉर्मेंट स्टेज में रहता है एंड देयर इज अ रीएक्टिवेशन इन द डॉर्सल रूट गैंग्लियन, इन्फेक्शन ऑफ द नर्व्स इट हैपेंस. ओके, तो यू कैन सी हियर द चिकन पॉक्स इज देयर, सेंसरी न्यूरॉन्स के नर्व एंडिंग में वो ऑलरेडी रहते हैं. ओके, and there is a kind of reactivation latent, you can see here latent form में ये रहता है. तो प्राइमरी इन्फेक्शन you can see here चिकन पॉक्स रहता था, वायरस माइग्रेट अप टू द सेंसरी नर्व्स. ओके, डॉर्सल रूट गैंग्लियन जो भी कुछ यहाँ पे रहेगा, ओके, वो यहाँ पे ऑलरेडी लैटेंट फेज में रहेगा. बट herpes zoster इन्फेक्शन यू कैन सी हियर क्या होता है, देयर इज एक्टिवेशन ऑफ वायरस इन द गैंग्लियन ड्यू टू स्ट्रेस, ड्यू टू काइंड ऑफ इम्यून सिस्टम सप्रेशन. ओके, इम्यून सिस्टम डाउन होने की वजह से देयर इज अ रीएक्टिवेशन. ओके, एंड वायरस माइग्रेट डाउन इनटू द सेंसरी नर्व्स. तो यू कैन सी हियर बॉडी में उसका अगेन रीडेवलपमेंट होता है. तो so you can see here the causes and risk factors. तो एज कॉमन इन पीपल older than 50, डिसीज दैट वीकेंस द इम्यून सिस्टम, HIV एड्स वगैरह जिसको हुआ है डेफिनेटली उनको होने के चांसेस ज़्यादा हैं. द कैंसर ट्रीटिंग पेशेंट्स who have undergoing a kind of chemotherapy, radiotherapy, definitely they are more prone for this kind of infection. Okay, the undergoing radiation or chemotherapy can lower the resistance to the disease and may trigger the shingles. And immunosuppressive drug are taking, if you are taking the steroids or long consumption of steroid you are taking, definitely they are having a kind of making a pathway to attack more and more pathogenic organism into your body. Okay, though these are the some causes and the risk factors of our herpes zoster infection. So you can see here the clinical symptom presented with the headache, feeling generally unwell, myalgia, fever. You will notice the first sign of the shingles may include, okay, because incubation period is 10 to 21 days. You will not appear a rashes with blisters on the first day. On the first day, that is called as the initial prodromal stages. You will not notice the blisters and all. You will notice the fever, unwell, and myalgia, pain in the muscles, and all these kind of symptoms you will notice. Okay, but acute stages you can see here rashes will begin to develop, often causing a pain. Okay, we can see here itching or tickling sensation in the area of the affected nerve. Okay, you can see here because it damages the nerve, and that's why there is a burning sensation or tickling sensation is there once it affected the nerves. Okay, and it formed the rashes over the skin. A fluid-filled painful rashes then develop as a few days after and commonly occurs either on one side of the face or the body. Okay, it is commonly occurring on the one side of the face and one side of the body. Okay, one sided, not the both half of the body. Okay, that you should know again, because just we have if we are dividing the body into two halves, definitely one of the halves it will affects and the next जो half रहेगा उसमें कुछ भी infection shingles virus का नहीं होता है. Okay, that you should know. So itching or tingling sensation in the area of the affected nerve started होगा, followed by there is a fluid filled painful rashes. It develop a few days after and commonly occur either on one side of the face of the body. Okay, the fluid filled blisters that break opens and crust over in 7 to 10 days, and this clears within 2 to 4 weeks. This is the just cycles you can say. Okay, this is a cycle just you can say. Okay, so once the nerve get affected, there is a tingling sensation, burning sensation you will notice, there is a rashes appearance, and followed by there is a presence of blisters, and that blisters get ruptures as well. They get opens and crust over in 7 to 10 days, and this clears within 2 to 4 weeks. Okay, this is the acute stages. So you can see it. Thus we have a discuss our kind of blisters रहेगा, one sided face of the one sided of the body पे रहेगा. तो you can see here इसके दूसरे part पे कुछ भी नहीं रहेगा, and anywhere of the body, anywhere part of the body it will affect. Okay, तो you can see here this is the just kind of herpes zoster infection का इसका kind of खासियत होता है. तो कॉम्प्लिकेशन क्या क्या हो सकता है? पोस्ट हर्पेटिक न्यूरेल्जिया. पोस्ट हर्पेटिक न्यूरेल्जिया मीन्स द पोस्ट हर्पेटिक न्यूरेल्जिया मीन्स नर्व को डैमेज करता है, तो कैन कॉज अ सीवियर नर्व पेन दैट परसिस्ट आफ्टर द रैश. ओके, एंड द पोस्ट हर्पेटिक न्यूरेल्जिया अकर्स मोस्ट ऑफन इन एल्डरली पीपल एंड इन पीपल हु हैज़ a kind of immune system who has a lowest immune system and have been compromised. Okay, so you can see here immune system compromised patient have a more prone for this post herpetic neuralgia and commonly seen in the old age patients. And one more things, ophthalmic shingles. You can see here ophthalmic shingles in or around an eye can cause a painful eye infection. Okay, so that is called as a ophthalmic shingles. Okay, the post-herpetic neuralgia and ophthalmic shingles, these are the two complications. You can see here Ramsay-Hunt syndrome. Ramsay-Hunt syndrome, otherwise known as a herpes zoster oticus, inflammation of several of the nerves that come out of the brain. The symptom of Ramsay-Hunt syndrome are facial ear pain. Okay, you can see here that is called as the Ramsay-Hunt syndrome. Encephalitis, hearing problems, then bacterial infection on the skin. They are all the complications may seen in our kind of herpes zoster infection. Now there is an involvement of cranial nerve as well. As soon as it affects the half part of the body, usually or normally, commonly, also there is a lead or damaging of the cranial nerve. There is an involvement of the cranial nerve as well. So, okay, we can see here we have a ophthalmic, maxillary and mandibular branch of our trigeminal nerve. So whole facies are covered with our the ophthalmic, maxillary and mandibular, or you can say trigeminal nerve. So it affect the just I said it affecting usually the nerves or nerve endings. So definitely there is a cranial nerve involvement may there due to the nerve ending. Okay, so zoster ophthalmicus, the shingle diagnosis, how you will diagnose these shingles. So you have to take the skin samples, you have to take the blisters, break parts, okay, that pulse वगैरह, and blood test. You will blood test, what you will notice in the blood test, increase in the white blood cells. So usually you will not notice these kind of things, increased blood cell, blood CBC वगैरह में there is not that much significant changes in the white blood cell you will notice. Okay, because virus does not increases the you can say WBC. Okay, so you can see here management, how we will manage this acute herpes zoster. So antiviral medication to reduce the pain and complications should be started within the 24 hours of first symptoms. This medication includes acyclovir, valacyclovir and famciclovir. So these are the antiviral medication that you have to start as soon as its prodromal stages appears. Okay, so that is nothing but our the herpes zoster infection. The management of post-herpetic neuralgia, the tricyclic antidepressants such as amitriptyline, opioids such as methadone, morphine, lidocaine, then anticonvulsants such as gabapentin, then capsaicin creams, topical anesthetic including the benzocaines to avoid the burning sensation. You have to give the topical anesthetic agents. Tricyclic antidepressants, patient may land in the depression, so you have to give a kind of tricyclic antidepressants such as amitriptyline, traztiptyline. Okay, so opioids also you have to give. So this is the management of post-herpetic neuralgia. So non-pharmacological treatment में you can see here, apply cold water compressed to the skin or soak in bathtub filled with the cold water. Okay, add finely ground oatmeal to the bathtub. Then calamine lotion you also can apply there. Then trim your fingernails to avoid the infections. Again, that is a you can say prophylaxis to you can say increase the infections, and wears a loose fitting clothing. Okay, this is non pharmacological treatment, okay, that you should know. So prevention, how will prevent this? By taking the vaccination in the childhood. It is given to the people 60 years of age and older who have already had the chicken pox. The shingles vaccine is a live vaccine given as a single injection, usually in the upper arms. The most common side effects of the shingle vaccine are redness, pain, tenderness, and swelling at the injection sites, and headache also noticed. Okay, so these are the shingle vaccine. It is a preventable you can say things we can take this to avoid the zoster infection. Okay, to avoid the herpes zoster infection. So once it occurs, once it occurs, so definitely by vaccine it will not treat. So before occurring, if you are taking, definitely it will good for that. Okay, so the prognosis may include many cases of shingles go away by themselves with or without treatment. The rashes and pain should be gone in 2 to 3 weeks. Normally वो चल जाएगा, but symptomatically we have to treat the patient. Otherwise, by complication, patient may land in coma. Okay. So however, shingle may last longer and be more likely to reoccur if the person is older, especially older than 50 years, and if they have a serious medical problem, it may reoccur. Okay. So that is all about for our the herpes zoster infection. Just I have discussed here, herpes zoster infection can be transmitted directly and can be reoccurred by chickenpox. Okay, so that is two stages you can see here by the of our varicella zoster virus. Okay, so that is all about for our varicella zoster virus and herpes zoster infection, that is called the shingles. Okay.